Husseini Salama, my colleague. She is an eminent positions both at the national and international levels. She is a professor of radiology and head of the radiology department at Egyptian Atomic Energy Authority, the program director of radiographical imaging technology department at Misr University of Science and Technology, and the director of radiation safety at the Egyptian Society of Radiology. Dr. Dina has chosen as one of the worldwide best 14 women radiologists through Women in Focus program held by the European Society of Radiology 2019, and as an African role as a model women leader in science and technology by IAEA GC side events 2018. Please, Dr. Dina.
Thank you very much, Professor Hani Hafiz, for the invitation. Thank you very much, Professor Tarek Dayasti, dear chairpersons and dear distinguished colleagues. It's my pleasure to introduce an introductory on the role of medical imaging and radiomics in the precision of zoonotic diseases and international call for action. Can we display, please, the presentation here? ممكن يا جماعة البرزنتيشن تتعرض؟ Thank you very much. So I'm going to discuss the role of medical imaging and radiomics in the precision of zoonotic diseases and international call for action. Radiological imaging became the golden standard in the diagnosis and follow-up of many zoonotic diseases. But actually, sometimes it has the privilege over some of the laboratory testing, maybe because it's faster, sometimes it's cheaper, sometimes maybe more available, but sometimes in zoonotic diseases, we find the radiological testing is more confirmatory to reach the diagnosis. So, with the current pandemic of COVID-19, proper chest imaging led to early diagnosis. It confirmed the diagnosis, leading to the best and appropriate triaging of the patients, isolation decisions, and treatment follow-up. For each one of you, it may be quite often to see those three different patients with similar radiological findings within your family or within your colleagues. But no one can predict up to this moment that how the course of the disease or the trajectory of the disease is going to be. For instance, the case number 1 went into mild symptoms and completely cured. But case number 2, with the same radiological findings, she went into severe symptoms and she had a difficult days at the ICU, and she cured after 3 weeks. And case number 3, unfortunately, died in 4 days. The whole world is concerned. Why 3 different trajectories of the disease? Is it genetic susceptibility or crossed immunity? Is it hypersensitivity, or is it a factor related to a communicable factor, age, gender, blood group? So radiologists decided to give a hand. They uncovered some radiological differences between the previously seen as similar pictures or similar images. No more these 3 patients will be seen as similar. We will see them as different. This is the science or the technology of radiomics. Radiomics has started in the field of oncology, in oncological departments, with a cooperation and collaboration between oncologists and radiologists, and then now extended to zoonotic diseases. And let me explain more, because this is the highest technology in our profession. Recognizing the pattern of similar lesions or merging the biological data with the radiological data to end up with a concrete, solid clinical correlation, this is radiomics. Actually, this will change totally the plan of management of the patients. This will let us predict the course of the disease and change the plan of management to every patient different than the other. So, analyzing quantitative information from medical imaging and extracting new biological findings using data algorithms is called radiomic features or radiomic signatures. So images are more than pictures, they are data. And the big data, by the way, is available in the low and middle income countries. But we need also the assistance of the developed countries to analyze and extract these biological data and end up in a solid, concrete clinical correlation. Radiomics combines radiology, computer science, data analysis, and machine learning. And the impact is high because it will increase the precision in medicine and improve the predictive power of the radiological imaging in these pandemics and in future pandemics. We will have challenges to apply radiomics, but we can overcome these challenges. There are solutions if we follow the right scientific approach, if we follow the right regulatory approach, and if we also keep the confidentialities of the patients intact. And in this important position of our annual conference of the Egyptian Society of Radiology and Nuclear Medicine, I'm always happy to update you with the international initiatives towards zoonotic diseases and imaging. And let me start with the Zodiac project. The Zodiac project is an IAEA project, International Atomic Energy Agency project, adopted by the Director General himself. Why? Because it prepares the world for future pandemics, and medical imaging, by the way, is an important pillar in this project. And I welcome you all to join this initiative. Another good initiative, which is the WHO Switzerland, the headquarters, there is a guidance on the use of chest imaging in COVID-19. They started to collect all the data of the efforts of the COVID-19 tertiary centers in the whole world, and finally end up in this important document disseminated to the health authorities throughout the 5 regions. And I have been honored to participate in both of them as an expert. But I have an important news for you that will make you very happy. Egypt, the هيئة الطاقة الذرية, is now having the first radiomics machine in Africa. And we are ready to cooperate internally and to support the African region. So for each field of medicine, clinical, laboratory, or radiology, those people will not wait for future pandemics to happen. But radiomics, genomics, and metabolics are getting ready to fight. God save you all, and thank you very much for your attention.
Thanks, Dr. Dina. دي الثالثة، يعني هي دي اللي أنا هقولها دلوقتي يعني. Strengthening radiology and medical science, دكتورة دينا بريز، ديانا بريز. Head nuclear medicines. ناخد من هنا بقى. Professor Diana Breeze is a head of nuclear medicine's diagnostic imaging sections divisions of human health and department and department nuclear science appearance of international energy IAEG EA.
Distinguished colleagues, it is an honor for me to be virtually present at this 57th annual conference of the Egyptian Society of Radiology. I would like to thank the president of the society, Professor Tariq El-Diasti, and Professor Hani Hafer, as well as my good friend, Professor Dina Husseini, for inviting me to join you today. It is an honor and a privilege to present in this 57th scientific conference organized by the Egyptian Society of Radiology and Nuclear Medicine. I would like to thank Professor Dina Husseini for inviting me today. In the next 8 minutes, I will talk about the role of the IAEA to support nuclear medicine and radiology, and will present an overview of some of our initiatives. Within the IAEA's commitment to transfer nuclear technologies for peaceful purposes, our role in the Division of Human Health, the division where I work, is to strengthen the capabilities of member states to address the needs related to the prevention, diagnosis, and treatment of health problems through the applications of nuclear and related techniques within a context of safety and quality of clinical practice. Two sections provide comprehensive support to the medical imaging community. The nuclear medicine and diagnostic imaging section supports establishment or strengthening of radiology and nuclear medicine within a context of appropriate use, safety, and quality of clinical practice. And the dosimetry and medical radiation physics section that enhances capabilities to implement radiation imaging and treatment modalities safely and effectively through best medical physics practices. In the IAEA, we support member states to establish or strengthen the practice of nuclear medicine and radiology in all phases or stages of implementation, advising on how to justify the need of a new department, modality of application, providing guidance on the planning and setting up of the right department adequate to the demographic and epidemiological needs, supporting the continuing professional development of staff, promoting the appropriate use of each type of imaging modality, the right test for the right patient, advising on how to adhere to the international and national standards and regulations, including radiation protection, encouraging the implementation of comprehensive patient-centered quality management systems in nuclear medicine, a program that is called Quantum, radiology, a program that is called Quadril, and in radiation oncology, the agency has a program that is the Quattro program. We also encourage the low and middle income countries to be part of coordinated research projects and contribute to solving gaps in the medical. The first step to providing adequate support tailored to the needs of countries or medical imaging communities is to identify the specific education and training needs. There is a need to assess what is needed, what is available and adequate, what is not available or needs improvement, and how can the deficiencies be remedied. And this has to be done for the different groups of professionals working in medical imaging, as well as for policymakers and for the patients. In parallel to the education and the continuing professional development, it is essential to ensure that the infrastructure required to cover the specific needs is available. Once again, the availability of trustworthy data is essential for evaluating the introduction of health technologies and for prioritizing the investment. On the one hand, reference data must be taken into account, including epidemiological needs, demographics, area of influence to be covered, availability and accessibility of services, infrastructure, availability of health technology and medical devices. And on the other hand, consideration should be given to the level of care and the clinical guidelines. All data needs to be analyzed and the gaps and need should be defined. This, in combination with the budgetary and the human resource situation, help to establish the priorities. One of the many IAEA global initiatives is the Medical Imaging and Nuclear Medicine Global Resource Database, IMAGINE, that compiles and presents in a comprehensive manner data on availability of nuclear medicine and radiology human resources and equipment. We started the compilation of nuclear medicine related data in 2006 and radiology in 2014. According to Imagine, 5 out of the 54 countries in Africa do not have access to CT scanners. 9 countries do not have MRIs, and only 7 out of the 54 countries have access to PET-CT scanners. One of the most recent accomplishments of the IAEA was to lead the Lance Oncology Commission on Medical Imaging and Nuclear Medicine, the first ever comprehensive effort to assess the need to improve awareness of and patient access to affordable and effective cancer care imaging worldwide. The Commission discusses the range of medical imaging modalities, interventional radiology, and radionuclide therapies used today, and the contrast in their availability around the world. The report focuses on the gap between high, middle, and low-income countries, especially in terms of resources, health system coordination, and education and training. Other topics such as the integration of imaging with other aspects of cancer care, health systems strengthening, system capacity, radiology infrastructure, and potential financing resources solutions are also explored, with the aim of providing a comprehensive call to action to improve access to cancer imaging worldwide. The Commission results show that scaling up access to imaging and nuclear medicine can prevent nearly 2.5 million cancer deaths by 2030, and by improving access to imaging, therapy, and care quality would prevent 9.6 million deaths worldwide. In addition, by improving access to medical imaging, a return of investment of $12.4 per dollar invested could be generated. If only access to treatment is expanded without the inclusion of medical imaging, the return, which is still good, would be 6.5 for every dollar invested, almost half. I would like to conclude by mentioning that at the IAEA, we make every effort to contribute to the strengthening and establishing of nuclear medicine and radiology in cooperation with all stakeholders. Our goal is to make nuclear medicine and radiology available, accessible, appropriate, and affordable. I thank you very much for your attention.
Thank you very much. I just want to thank the speakers. They were supposed to be with us here, but due to COVID-19 challenges and recent updates, The United Nations now are updating the status every 1 week. So we're very happy to be on site here with you and present themselves the lectures, but at least they are with us, and next year إن شاء الله نتمنى أن الأمور تكون اتحلت. And thank you very much. I will leave the concluding remarks to Professor Hani Hafiz.
فعلا احنا بنشكر كل الناس اللي يعني تعبوا معانا من وكالة الطاقة الذرية، وكان نفسهم فعلا يعني لغاية آخر وقت احنا كنا بنراسلهم وكان نفسهم يحضروا، والحقيقة يعني الدكتورة دينا طبعا هي واجهتنا هناك، وهم طبعا بيحبوا ان هم يتواجدوا في مصر، لكن ان شاء الله في اقرب فرصة يتواجدوا معانا، وان شاء الله نعمل ايفنت مخصوص للسيفتي في الراديولوجي، لان ده هو ده يعني الساعة، يعني ده الحدث اليومي دلوقتي اللي هو موضوع السيفتي. احنا ان شاء الله هننهي البلينري سيشن دي الان عشان اتاخرنا شويه على البريك، معلش اخرناكم. البريك يعني هنحاول يبقى وقته مش اكتر من ثلث ساعه، عشان بس من يعني متاخرين احنا حوالي ساعه الا ربع، وهنبتدي السيشن اللي بعديها اللي هي سيفتي اند ريسيرش. السيفتي اند ريسيرش برضو الجلسه بتاعتها هتبقى للاساتذه راديوجرافرز هيبقوا موجودين معانا، هتبقى دي اخر جلسه تخصهم ان شاء الله، وطبعا اطباء الاشعه معانا في الجلسه بتاعت السيفتي وريسيرش اللي بنستضيف فيها ناس من قمم السيفتي وريسيرش في مصر من تخصصات ثانيه.
السيفتي وريسيرش بي يا هانس.
نعم.
السيفتي وريسيرش بي.
السيفتي ريسيرش بي هنا هتبقى جلسه اعتقد البلمونري ايمجنج. الحقيقه الدكتور عوض تاج الدين الحقيقه هو لسه مكلمني، لسه منهين اجتماع مع سياده الرئيس، فما اعتقدش ان هو هيوصل كتشير بيرسون في جلسه البلمونري، لكن ان شاء الله هنبتديها في ميعادها بعد الجلسه دي على طول، والراديشن سيفتي اند ريسيرش هتبقى في القاعه الثانيه بعد البريك ان شاء الله. شكرا. اتفضلي دكتور.
تعليقا على كلام الدكتور هاني، انا بس احب انوه على حاجه. الحقيقه الايجيبشن سوسايتي اوف راديولوجي تحت رئاسه الدكتور طارق الدياستي وتحت اشراف الكوميتي الموجودين دلوقتي عاملين يعني جهد رهيب ان احنا نبقى ريكوجنايزد، والسوسايتي لها انفلونس يا جماعه لا تتخيلوا قد ايه مهم at the international level and the African level and the Middle East level. بنشكر جدا دكتور طارق ودكتور هاني وكل الكوميتي ممبرز. الحقيقه عصر ذهبي للإيجيبشن سوسايتي اوف راديولوجي، expanding, cooperating here and there. Thank you very much.
شكرا دكتور دينا. سعيدكم، اتفضلوا ان شاء الله، ونحاول بعد ثلث